Hi, I'm David Feldshon. I'm a gastroenterologist at Minnesota GI, and I'm also certified by the American Board of Obesity Medicine. A new device that we are very excited about and which is now FDA approved is the gastric balloon. This device has been approved and in use in Europe and South America for up to 20 years. The device appears to be quite safe. The device is a silicone balloon that is filled with saline and stays in place for about 6 months. The weight loss achieved with this is about 10 to 15% of total body weight. It must be utilized in conjunction with a medical weight loss program.
This is what the balloon looks like prior to insertion. It's basically on a long plastic tube, essentially swallowed like a piece of spaghetti. Once in place, the balloon's inflated with saline, and it has a shape and size of approximately that of a grapefruit. And it's soft, it sits well in the stomach without causing much irritation. This is the appearance of the balloon in the stomach. It's too large to be passed into the intestinal tract and will just sit in the stomach, slowing one's ability to eat. So again, it's placed through the mouth like a nasogastric tube. The patient will be heavily sedated, so they're essentially not conscious. The small tube, which is part of the insertion tube, is then connected to the balloon and filled with 500 cc's of saline. The tube then detaches and leaves the balloon in place in the stomach, and it's designed to stay in place for up to 6 months. Upper endoscopy is performed at the same setting to be certain of correct balloon placement. This is just a short video highlighting how the tube is placed. Again, it's inserted through the mouth after heavy sedation. The endoscope is advanced to be certain that the balloon is actually in the stomach. It's then filled with saline, and a total of 500 cc's is put in, which is equivalent to about 2 cups. Following this, the insertion tube is removed, and the balloon sits in place. It slows absorption. After 6 months, the balloon is grasped, deflated, taken out. It's a non-surgical system. Probably the biggest advantage is that one's stomach is back to normal after the balloon's removed. It's the #1 weight loss balloon used around the country, and about 3 times the weight loss is achieved than just diet and exercise programs. Contraindications to the balloon. The biggest contraindication is any previous gastric surgery of any type increases the risk of perforation. Any prior intestinal surgery is a relative contraindication, and in particular ulcerative colitis or Crohn's disease, large hiatal hernia, cirrhosis of the liver, blood thinners, an inability to take PPI medications such as Prilosec or omeprazole are all relative contraindications, and in certain cases we might be able to get around those issues. Diet, it's very important to follow a progressive diet after balloon placement. In the first week, one's essentially just on clear liquid diet, and the reason is that there's fairly significant nausea and vomiting, abnormal gastric emptying, and clear liquids minimize a lot of these symptoms. Week 2 is basically advancing to a full liquid diet. One can have some cottage cheese, eggs, sugar-free pudding, low-fat yogurt, but in essence, it's full liquids. Weeks 3 and 4, one's basically progressed up to solid food. Tender or ground meats are okay, including fish and chicken. Low-fat cheese is okay, creamy peanut butter, whole wheat bread, sweet potatoes, brown rice. Sweets and sugar for the first time are okay in small amounts. The balloon tends to delay gastric emptying, and therefore things that are difficult to digest or pass through the stomach anyway are going to be much more difficult with the balloon in place. So skins, tough meats, gristle, high fat, potato skins, white rice, sticky pasta, any of these things are more difficult. In addition, it's recommended not to drink liquids during the meal. Liquids should be confined to prior to the meal or waiting at least half an hour to an hour after the meal. Complications mainly revolve around balloon deflation. The risk of balloon deflation is rare, provided the balloon is removed at 6 months. There's probably some deterioration in the balloon if it's kept in longer than 6 months, and then deflation or partial deflation can occur. Typically, the balloon will pass through the GI tract and be passed in the stool. If there's prior gastrointestinal surgery of any type, that increases the risk of the balloon getting stuck and causing an obstruction. And of course, nausea and vomiting can be significant the first week. We strongly encourage people to be aware of that prior to balloon placement, and to be patient that these symptoms will frequently subside after the week is over. Results: weight loss of 10 to 15% of total body weight for a 170-pound person. That means about 17 to 25 pounds. It should be done in the context of a comprehensive weight loss program. You'll get better results if one is enrolled in a weight loss program, and we do offer that as part of the balloon placement at Minnesota GI. Weight regain is slower with balloon placement than with simply diet and exercise alone, and probably the weight regain is about 25% of whatever was lost at 1 year.
It is important to note that the gastric balloon is not covered by insurance and involves direct payment by the patient. There is a financing option available, and you may be able to utilize flexible spending account dollars if your employer has such a plan. Minnesota GI understands the health and quality of life benefits of reducing weight and has created serious solutions with our medically monitored weight management programs and weight reduction procedures. If you have further interest in the gastric balloon, we encourage you to seek out more information on our website and then contact us if you would like to set up a consultation at our St. Paul Clinic location. Thanks for watching.